Good afternoon, ladies and gentlemen. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator, Jennifer Thornhill-Verma, Senior Director at CFHI. Please go ahead.
Thanks very much for passing it over, and thanks everybody for joining. This is our first webinar for the Momentum teams joining the second round of the Sustainability Challenge, so we welcome you here today. As ever, we do want to start by acknowledging that we're meeting on land that has been inhabited by Indigenous people from the beginning, and in particular, we're broadcasting today from Ottawa, and it's the traditional Montreat territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. By way of housekeeping, you've already started to do this, but if you haven't already, take an opportunity to introduce yourselves. I know you know those in your own particular collaborative, but it's an opportunity to get to know teams across the two collaboratives, and I will introduce the teams joining us today momentarily. We do simultaneous interpretation, so this is being translated en français. At any time, if you have questions in English or French, please feel free to post them, and we're going to be doing some simultaneous translation in the chat box as well. Okay, so in terms of who's here, we have two collaboratives that have joined for the second round of the Momentum Challenge. And so the first set of teams I'll walk through are the appropriate use of antipsychotic teams. So these are teams who've been providing a person-centered approach to care for people living with dementia, I think identified as having been prescribed an antipsychotic. Of course, dementia isn't a psychosis, and so you've applied a person-centered approach to care. So from Newfoundland and Labrador, we have Bombay Healthcare. We have Bay St. George Long-Term Care. In Burgeo, we have Calder Healthcare. We also have the Cornerbrook Long-Term Care Home. I saw you were first on the line and first introduce yourselves, and that's where I'm from, so I love that you're gainers. The Dr. Charles LeGros Healthcare Center in Port aux Basques. And on Prince Edward Island, we've got Beach Grove Home, Colville Manor, that's in Surrey, Prince Edward Home in Charlottetown, Riverview Manor in Montague, and Wedgwood Manor in Summerside. In the Embedding Palliative Approaches to Care, EPAC, so I think we will start to use some of the acronyms. So for the appropriate use of antipsychotic, we'll use AUA periodically. And for Embedding Palliative Approaches to Care, EPAC, in case you're wondering what that is. In Alberta, we've got Bethany Airdrie, also Shaughnessy Lifestyle Options. From Quebec, we've got our Centre Intégré de Santé et des Services Sociaux from Mauricie. We also have New Brunswick, the Central Carleton Nursing Home. And back in Newfoundland and Labrador, a second team joining us from Port aux Basques from the Dr. Charles LeGros Healthcare, and also a second team from Cornerbrook Western Health, the Protective Community Residences. And finally, all the way west and up, Yukon Continuing Care from Whitehorse. So quite the spread of teams that have joined us for this second round of the Momentum Challenge. We're really pleased that you could be here and that you're going to be a part of this sustainability opportunity. So as I mentioned, Jen Thornhill-Verma, Senior Director here at CFHI. I'm actually joined today in studio by Jason Geert, and Jason is incoming faculty member for this particular collaborative, but he's also a lead researcher and program manager at the Canadian Health Leadership Network, CHL-NET, manager leadership and partnership development with CCHL, and you also do teaching, I think, at Sherlock, among many other hats that you probably wear. Laura Lennox isn't here today, but Jason's actually going to be sharing some of her slide content. She's a new faculty member that's joining us as well for this round of Momentum. And she's Canadian, actually, from Ottawa. She's the Associate Lead for Improvement Science and Quality Improvement at the National Institute for Health Research in Collaborations for Leadership and Applied Health Research and Care in Northwest London. So she's actually providing some of the content for today's call. We also have our program leads, and I think all of you have been in contact with either Lindsay or Sabrina. So Lindsay is joining us today from Kingston, and Sabrina is joining us from Newfoundland and Labrador in St. John's. In terms of what we're trying to achieve today, so number one, we want it to be an opportunity for you to meet one another. So do feel free to keep using that chat box. I see that it's been quite active, and that's great. Use it as an opportunity to connect with one another, If you like what you're hearing, have questions about what you're hearing, ask us, share that with each other in the chat box. We're going to start with a resident impact story. I'm going to be turning to a colleague from Momentum 1 Challenge momentarily to talk a little bit about that. But similarly, we're going to be looking for your impact stories. How is the work that you're doing to sustain improvements for residents, for patients, for families, improving their lives? We're going to provide as well an overview of what's called the long-term success tool. I believe actually most of you are probably familiar with the tool. You may have used the tool in the first round of your collaboratives with CFHI. You can clarify that for us or not. But we're going to talk a little bit about some of the factors related to engaging senior leadership. That's one of the aspects of the tool. And also maintaining sustainability. This is really to prep you for a future challenge that you can get involved in. Finally and importantly, we're going to give you a full overview of what's coming related to the Momentum 2 Challenge. We are going to be providing you with a key dates document. I think you would have seen a draft of that already, but it will be a finalized version, so you'll get that after today's webinar. It's going to provide key dates for upcoming webinars, data submissions, award deadlines, and so forth. But for now, I'm going to turn actually to Kelly Brown. She's with the 9 Circles Community Health Center, and Kelly is a part of the first round of Momentum and part of the Connected Medicine Collaborative, which connects primary care providers to specialists to provide specialist feedback to patients. So I think Kelly will first go to you.
Hi, everybody. I'll give you a little quick background on what we do. I'm with eConsult Manitoba, and it's a secure web-based tool that allows primary care providers to submit non-urgent patient-specific questions to participating specialties. And so the specialists are expected to respond with either a recommendation, ask for more information, or suggest the person that an in-person consultation is needed. So it's really helpful for decreasing wait times. It's helpful when a patient's remote, and I just wanted to share one story, a patient impact story. So this is from the perspective of the primary care provider. The patient gave permission to talk about this story. We're not going to disclose any information, but so I'm just going to read it out to you. So the patient, and we're in Manitoba too, so the patient was in a place called St. Teresa Point, which is a remote community hours away from Winnipeg, our biggest center where most specialties are. Most remote communities either have nurse practitioners or primary care providers. So this patient, from the primary care provider's perspective, she says, I was asked to complete a routine pre-op for knee surgery for a 53-year-old male. It included an ECG. So when she reviewed the ECG, she saw significant abnormalities. The patient said he did have episodes of lightheadedness. I was unsure if we should proceed with his knee surgery or have cardiology do further investigations. Since he lives remote, the traditional consult would mean I'd have to refer him to cardiology through their central intake, and we'd have to arrange transportation and accommodation for his appointment because he'd have to travel to Winnipeg. This usually takes months to organize, and I was unsure if it's even necessary. I submitted an e-consult on November 27th and heard back on December 2nd. The cardiologist reviewed the ECGs and requested a 24-hour Holter monitor prior to surgery. I was able to order this investigation within a week. The same cardiologist will review the Holter monitor results and respond to the original question, which was, is it safe for this patient to proceed with surgery, likely by the end of December. The patient's surgery is scheduled for February, and I have not been able to confirm his safety for surgery from a cardiac perspective without having access to eConsult. He was very relieved that we were able to have cardiology review his ECGs, and he didn't have to travel to Winnipeg to see the cardiologist, likely requiring us to delay his knee surgery. We look forward to hearing back from cardiology when she has reviewed his Holter monitor results, and we can go from there. That was my main patient impact story. There was a lot of good benefits to it, decreasing wait times and decreasing travel and costs.
Awesome. Thank you so much, Kelly, for agreeing to be on and sharing that experience from one of your patients involved in the Momentum 2 or Connected Medicine Collaborative. We appreciate it. Again, we're going to turn now to Jason And if you do have questions throughout this portion, feel free to pose them. As I mentioned earlier, this content really comes from Andrew Lennox, but I think Jason's going to give a bit of a self-intro to begin in any case. But feel free to pose questions and we'll get to those post.
Yeah, hi everyone. So thank you very much for having me. It's a real honor to be here. And as a very quick addition to the intro, so Dr. Lennox and I both did our PhDs in the UK, and we're both Canadians, and I still am currently a lead researcher for the NHS among, Jen said, about 7 other jobs. And so it's a helpful contrast. There's a lot of research that's happening in the UK and here, and they're much more helpful, I find, than American studies, for example, because of the differences in the healthcare system. So I first became really interested in QI and quality improvement initiatives because my dad is a thrombodoc at Sunnybrook, and blood clot prevention is one of the clearest instances in medicine where if you do this to prevent blood clots, not only do you save tens of thousands of people's lives, you also save millions of dollars. You put that on the front page of the New England Journal of Medicine, which it was, and among intelligent practitioners, that should be the end of the story, but it's not. Similarly, an even more extreme example, I worked with Dr. Michael Gardam, who's the chief of staff at Humber River, and he worked with CPSI to get people to wash their hands regularly across healthcare centers in Canada at a time when the Ontario governmental policy was just wash your hands. Do you really need an RCT to tell you to do that if you're a surgeon? And yet, it wasn't, just by announcing it didn't create any widespread behavior change. And lastly, I'm a social scientist. I've spent the last 10 years coming up with evidence about how to train leaders best and measure the effect of leadership after, and then share it, and then ta-da, look, that life is happier in multiple centers. And what I've learned on all 3 counts is that without real implementation strategies and sustainability strategies, there is no widespread behavior change. So this is a real area of interest and passion for me. So to go through Dr. Lennox's model, there we go. So the problem is that this is one study of many. That basically there are all kinds of models of how to integrate and sustain quality improvement initiatives. And there is evidence that the sustainability can happen, but there's a lot out there, and it's hard to know what's the most reliable. So what's the problem? Well, my experience in healthcare, the problem with all this is not the people. Every person I've worked with in healthcare, and there are personalities, of course, but is in it for the right reasons and has good intentions and really is trying his or her best for the sake of the patients and families and communities. But the problem is there's a lot of priorities. There are metrics that are so numerous. It's hard to know what to focus on. Sometimes it's easy to do the quick things, or if you've got 75 emails coming in every day, sometimes life carries you away in a way it's like Monty Python's 100 meters for people with no sense of direction. As soon as the gun goes off, you just scatter because that's what the pressure makes you do in life. And so then there's also another problem is we're all so busy, but not recognizing what is a really reliable way of going about this, because there's always good intentions, but things don't always work out if we don't have the right structure in place. So as Dr. Lennox says, there are many models, there are many approaches, and she's come up with one that we are very confident that will help. So, for example, more studies saying that there's just a lot out there. This is all familiar to you, so we're going to skip over this part and get to what are the kinds of models that are available. So first of all, many are checklists. We've seen those before in surgery and other places. And then there are many models and tools we can see in the top of this, many different settings, many different users, and a lot of different purposes here. So are we evaluating how are things going? Is it helpful to help us plan things? Does it help us along the way through guidance? And most helpfully, of course, ones that are a combination. If you're only evaluating, then that's not enough. If you're planning but not evaluating, that's not sufficient. And if in the middle you're doing your best and things aren't going perfectly and we don't give you anything to help you along, that's not ideal either. So what we need is something that has a combination of all 3. So her model, there's two basic theoretical perspectives. First of all, there's a linear process. This is not just a scattered set of helpful tricks and tools or pieces of advice. This is a process with a beginning point. You start with the end in mind. My model of leadership development that's being published tomorrow is an outcomes-based model. It's the same concept here. And second of all, that the process is essential. This is not just as simple as here's what we know will help, let's get to it. There's other things that we need to do in order to guarantee success, and you must have already seen that in your initial work, and we're hoping that what you hear today reinforces what you found to be helpful and also gives you one extra thing to sustain the work that you continue to do. So first of all, what can we do with all this ambiguity and uncertainty to reinforce the extremely important work that you're doing? So we need to consider where are we going in the long term. Where in my work with Leads Canada, with leadership development, people, they have tight budgets, so they say, well, we need like a program to just solve all our problems. And it just doesn't work greatly like that. We need to have a longer term perspective in mind in order to optimize the success. Likewise, we need to review regularly, make sure that we are reflecting on, we know these things work, are we doing them, to what extent, what's the feedback we're getting, because it's not just as simple as it's a causal relationship, you do this and it works out. We are organic beings in complex organizations, and the social part of me being a social scientist is as interesting as the scientific part of how can we make this work for you given your organizational context and the people with whom you work. And then likewise to forecast, are there any risks or barriers in mind, and what can we do to either circumvent those or to overcome them? So here's how this works. Here's one example. This is another study that said this is a model in the NHS that was used over a long period of time, a huge sample size, and although people thought it was valuable, it seemed to be a little bit difficult to understand. And so I get that there's a lot that everyone has to read, there's a lot that everyone has to do, so what can we do to make it simple that is highly reliable? And so that's what Dr. Lennox's model sets out to do. So essentially, here we have in the middle, the obvious goal is the long-term success, and she wanted to create a tool that would reinforce that. So how do you go about it? Well, you do a literature review, and we've already seen examples of highly evidence-based information that informed this. But in the world of healthcare, which is not as simple as what life is like in the library, you need to check in with people through focus groups and interviews about what does this resonate with you in your actual job? Would this work? Or how would this work in your place of work? To make sure that it actually is something that will serve you well rather than nice in theory, but because you've never left the library, this actually won't work very well. So, and then of course any great study or model starts with a pilot project. So 84 different stakeholders were involved in that, as well as the past experience of subject matter experts. So as far as creating a robust tool, these are the 5 elements that everyone would agree are quite helpful to guarantee that it's evidence-based, which in what we do is very important, but also that it really resonates with the people who day in, day out are doing the kind of work that we need to be doing in healthcare. So what are the factors for long-term success? And I recognize, as Jen said, some of you may be familiar with this already, but it's always helpful to just have a little review when the phone isn't ringing off the hook and you've got 7 people waiting to see you next door. So there's three areas, so the people, practice, and setting. And then within those, so the people, the involvement, the blood clot research. To be part of the initial study my dad did for the New England Journal publication, you could not be a center who was involved in the study unless there was a written letter from the CEO saying, I support this, I know what's happening, and I know who's in charge of this, and I'm willing to provide the resources to make it happen. Because we know that we may think that what we're doing is fantastic, and it very likely is fantastic, but we haven't really let any of our coworkers know what's going on and asked them if it resonates with them, how might it help them. Then we know that the widespread change potential is much more limited than if you actually involve the otherwise wonderful people with whom we work. Of course, in order to do this kind of thing, there are skills and capabilities, leadership and teamwork wise, that are quite essential to pulling this off. A great idea doesn't make magic on its own. And then the functioning of the team is wonderful exercises that we've all done, that even with equally competent, smart people, there are very different ways of going about the same kinds of things. And so a high-functioning team is essential to optimizing the kind of work we're doing. And of course, this is a given, but it's still helpful to say, we all need to be committed to this. And not that anyone has bad intentions. It's just given the factors that we mentioned earlier about what's the problem. We're all busy. We've all got a lot of pressure. We may be dealing with other things in our lives as well. But this has to be fundamental because we can't make all this happen without the commitment of our team members. And we know this, but it's just helpful to echo them one more time. And then practice-wise, so what we're getting from this tool is help with the kind of solid but also adaptable processes that are going to reinforce the kind of work we're doing. That it's also really helpful, as we've said already, to monitor the progress we're making, to get feedback, incorporate that in an iterative way so that we're constantly evolving. And then very helpful, I find, in the consulting work that I do, especially early on, to promote and communicate the evidence of benefits, both prospective ahead of time, but also early wins and internal champions who can say, you know what, you did this and it's really helping, and let's honor and recognize you in a way that is good in and of itself, but it also sends a message to the rest of the community. This is a priority, it's happening, and it's working. So let's all band together, and the more the merrier, so to speak. And then making sure that you have the resources, which in terms of personnel, tools, financial, technological, that you need in order to do this. So alignment with the political and financial environment. So there are things that are imposed on us. So the introduction of EMRs, for example, sounds so straightforward until you talk to an emerge doc, for example, and say, like, well, what kind of a Flintstone world do you want to live in? We're still handwriting notes. But in fact, if it slows people down at a time when there's real pressure to see as many patients as possible and provide top quality care, now all of a sudden it's a slightly more complicated thing than just this person has a bad attitude. So making sure that we're aware of what's going on across the country in healthcare, and as well as in our own provinces when there are differences. And then it's very helpful. The organizational culture is absolutely fundamental. To an economist, the environment is considered an externality, which you can imagine how David Suzuki reacts to that. But in our work in leadership, no matter how great any given program is, if we haven't prepared the environment for sustainability and to be ready for the change that's coming because we involved them in it, it doesn't matter how great the program is, it's never going to be great. So it's really important to engage the key stakeholders, as we're going to see. And then a lot of my work is with healthcare CEOs, and sometimes they'll say, well, I'm not too sure how leadership is that important. We've got other things. So then my question to them is, well, what is fundamentally important to you in your organization right now? And whatever that is, and I say, okay, well, let's just focus on that. We're going to use leadership in order to accomplish that. But focusing on a project, or leadership in my case, as a destination is misguided. Focusing on what is that we are really fundamentally committed to as an organization, and then using all the skills and the teams and the tools that we've been describing in order to address those, that's where the real magic happens. So here are the 12 factors within those that we've just outlined, and this is the basis of the model that Dr. Lennox has come up with. And so what we want to do with these, so how it works is, it's kind of like a 360 but for the team based on the model. And so how it works is you anonymously evaluate how you think things are going according to these 12 factors. We get the feedback, we discuss it, and then we decide how we're going to revise, communicate more. Sometimes it's not things are going poorly. We're just not really that sure, and we need that kind of information in order to optimize our work. And then, as we said already, action to mitigate risks. I think what she probably means are predictable barriers or obstacles, because there's risks involved every time we leave the house, basically. But this is the kind of thing where what could interrupt the kind of work that we are achieving or aiming to achieve through our projects. And so we've said here this is a really simple tool to be able to use and also to facilitate the kind of dialogue, but which does two things. It provides a common language, which is really essential for how we communicate about how things are doing, and by virtue of doing this, it brings us together in an intentional way that, despite our busy schedules, we may not along the way in quite the same way. So I'm highly in favor of this kind of thing. Similar to a leadership capability framework, this is an even more focused version of the similar benefits. So this is an example of what it looks like. This is a made-up example of what the report would say. So we've got examples where the green, so where you want to be in the green, basically. This is like a golf-type pool where green is good, and like in every other aspect of life, red probably means things are not great. And then yellow, this is where we got a big uncertainty, unsure here. So it highlights where you are on the spectrum for each of the 12 factors. So we've got the animation here just to show, okay, so in some cases we've got lots of green, that's great, but like the second one, involvement, we've got the highest amount of like the dark green, which is awesome, especially if you're an environmentalist, but then also quite a big red as well. So that needs to be addressed too. And then the top one, let's look at how much yellow there is, and the bottom one as well. So alignment with the external political and financial environments. There's a lot of yellow there. And if you're working on a micro level, that might be okay. But the more you try to expand, those kinds of coalitions and political considerations start to become really essential, sorry. So this one, the comment for involvement is that, yeah, the team's doing well, but there's a small number of people who are doing most of the work. And so that can be problematic from a burnout perspective. It can be problematic from a morale perspective, where the people who are high achievers are doing a lot of work, but then might get resentful that it's not equal. So it's something that it's good to flag early in a way that isn't personal or an attack, but can facilitate the dialogue that will improve, hopefully, our teamwork together and, most importantly, our results. So there's also, I mentioned already, there's good, there's the bad, and there's the unsure, which is, in our research, we stay away from anecdotal as a term. It doesn't mean a negative word. It means it's unclear, really. And so this is helpful for us as well to say, like, the resources in place is a big one on this one. And if we're launching something that requires technological, for example, or financial reasons, and we're not sure that many people are not sure if they're in place, that needs to be something that we find out pretty early on before we get everyone really excited about what we're doing, and then realize, oh, we actually forgot that we are doing a webinar and we don't have the equipment to do it, for example. Poor forecasting on that one. So basically, this is what Dr. Lennox has found, that she's conducting a study using this instrument with 56 different teams in the UK, and has found so far that it's enhanced collaboration, decision-making, and action planning. So this is great news that we are people, both she and I are people who are active researchers on an international scale, but like the rolling it out part, because not only is it fun, but it confirms or nuances or to some small extent disputes what we've come up with. So this is very helpful, and it's wonderful to see that she's doing this, and now that we're sharing it together. And so this is my last slide here, but basically this is just a very beautiful, complicated graphic about the process, about how this tool can support the sustainability journeys, at different time points. Because as we said, it starts one way, but then we reevaluate, we adjust, we refine, we move forward, and we do it on repeat again. So that's it for my time, but I will be with you for the rest of this call and other times. So thank you very much for your attention.
Great. So gang, Sabrina asked a question. She was curious to know if any of you have used the long-term success tool in your collaborative previously. We'd be really encouraged to hear about your experiences. And I'm actually going to turn it over to Lindsay, because, of course, you'll have an opportunity now to apply this as it relates to the Momentum Challenge. So, Lindsay, turning to you.
Thanks, Jen, and thanks, Jason. That was a wonderful overview, and I think certainly what I've heard in some of the conversations with the teams so far is that we have several teams who've used the tool and several teams who haven't. So I think a great chance to practice and delve into this a bit further. So, as we go through the next 2 slides, I'd encourage you to just think about what of this resonates with you. Are you already using a tool that you're finding effective? Is this something you've thought about? And how might that process look for you? So as Jason mentioned, it is a very straightforward tool. It takes about 10 minutes to complete, and we're going to walk through how that process would look for you in terms of completing it. And to make it easy, we've actually structured a challenge around this. So our challenges and award opportunities are designed and based on not only the needs of teams, but we try and use the principles, practices, philosophies that support you with sustaining your initiative and giving you a chance to practice what we've talked about on webinars. So really using those adult learning principles that we often talk about in our practice. So just a reminder, challenges are optional, but we certainly encourage you to participate. Not only do you have a chance to access the financial awards, but you're then able to, again, practice those principles and build in further plans to sustain your initiative. Certainly from what I've heard so far, the teams have put in an incredible amount of work to get where they are with their improvement. So we certainly want to identify principles that can support you in sustaining that. And unfortunately, in quality improvement, it's not just front-end loaded. There is ongoing work that's needed to maintain and monitor that improvement. So in today's challenge, you may also see some of the work that you're already doing, quite frankly. It might be a different way to articulate it. It might be capturing it in a different format. But we really hope that you'll start seeing yourselves and the teamwork that you're doing within what we're talking about. So today what I want to do is give a brief overview of the challenge, but please know that Sabrina and I are here with a phone call or an email away at any point during your journey, and that may involve connecting you with a member of the faculty, offering some coaching. So know as we talk through this today, even in relation to the award challenge, we're here to support you and have access to great experts like Jason and Laura that can certainly help you get stuck along the way. So this challenge is focused on the core principles that Jason spoke of. It's an opportunity for you to engage your senior leadership team because we do know that leadership is a critical part of engagement. So we're going to provide you with the templates, the resources, all the articles and links that you need. So what you're going to do is you're going to complete an action plan using the templates that we've provided. It's got 7 key steps within that action plan, and share a 1 to 2 minute video on your experience with this. It's due January 17th at 5 p.m. Eastern, and you're going to need to submit it through the portal. But just to let you know, if you're having any challenges with the portal, we're here to support you through that. So it is a hard stop, though, on January 17th at 5 p.m. These are legal terms that have been drawn up because there is a financial award. So please, if you're encountering any issues, reach out to Sabrina or I in advance of that 5 p.m. deadline so that we can support you in getting that work uploaded. And of course, we have 5 awards of $5,000 each available, and that's money that you can use as you'd like to support the project. So we'd love to hear about how you use that to support your work, but there are no strings from us telling you how you need to use that. We certainly suspect that you have priorities and know your organization best in terms of what's needed. So let's dive a little bit into the plan. So the first step is to complete that long-term success tool that Jason talked about. That is in, if you haven't had a chance to look at the terms and conditions yet, that's attached for you, and we have electronic copies as well. So you'll want to pull your core team together to complete the tool. The core team is really the folks with the day-to-day responsibility of your initiative. Each of those folks is going to complete the long-term success tool on their own. So as Jason said, it's anonymous. It's not about names. It's about then pooling those results. So once you each complete your scoring, you're going to input that into a spreadsheet. So Jason showed you that wonderful graphic that comes up. Green is good, red is an opportunity or a risk. So we will share that with you. And just so you know, in terms of the process for Momentum, what happens is after each webinar, usually about 3 days later or so, but within the week of the webinar, what we'll do is we'll send you out a recording of today, all the resources that we've talked about, any attachments, etc. So all that will be coming your way. So you're going to take that spreadsheet that you received, and you're going to enter the team information that you've got. So if you have 3 or 4 folks from that core team who completed that survey, those results are basically going to collate for you. And it's going to give you an overall score of your risk factors and opportunity factors. So you'll see risk will be red, opportunities will be green. So you'll then start filling out the action plan based on what you learned through completing the long-term success tool. The action plan that's on the screen here has 7 key steps. So you're going to follow it sequentially. And as you see on the screen, it talks about contributing factors that are risk-related. So, for instance, that may be, commitment to, so for instance, if you had commitment to the improvement was one of the challenges, as you explore that with your team, you may actually identify that one of the commitment factors is staffing resources or staffing turnover. So this is where we're looking for you to reflect on what might actually be driving some of those challenges. So while you're completing the action plan, we also want you to keep in mind the scoring criteria. So that scoring criteria is located on page 5 of the terms and conditions, and we'll include that in the email as well, just so you have easy reference to that. That will identify what our judges are looking for when they're reviewing your plan. So really important. Please don't forget about that, because that will really help you in increasing your access to those awards. We also want you to consider at what point you want to engage your senior leadership team. They're a really important part of your sustainability, and we're looking to see that reflected in your plan. So your work with the team may involve completing this as a core group, and then working with your senior leadership team for feedback, for their buy-in. It may also involve sitting down earlier on with the senior leadership team. It's really up to you of how to best do that. So please start considering how that might look, because certainly I know it's the holiday season, so it's a busy time for certainly the next few weeks. We're also going to share in the chat box an article you may find helpful in engaging your senior leadership team, talking a bit about how to engage the executive team in quality improvement and some things for them to consider. So that's called an executive review of improvement projects, a primer for CEOs and other senior leadership, and that's from the Institute for Healthcare Improvement. So often access a number of resources from them. So we'll include that in your email package as well, but that'll give you some hints for completing the action plan, some ideas of what actions you may want to add in that reflect that senior leadership engagement that our judges will be looking for. So always a good idea to look at those resources, because I think you'll find some ideas. So back to the action plan. As you complete the sections, you'll be, again, just filling out what's relevant to your team. So it is very individualized. And that's why Sabrina and I are here, as well as our faculty members, because if you do get stuck on a certain point, probably worth the individual conversation of what's relevant to your team. And you'll see there are appendices designed to help you along the way. These are in your terms, but again, we'll also include those on the email. But I can't say enough, those resources will really help you as you complete this plan. So please take a moment to look at them. They're all fairly straightforward. We've tried to keep them manageable, because we know it's really challenging to find the time for quality improvement work. So trying to package that information for you. And ultimately, we look forward to seeing your submissions and what you will be sharing in terms of opportunities and risks. And we will keep building on these in future webinars so that we can tailor a bit of that content to some common themes that we see across the project. Well, those are the key 7 sections. Again, we're here to help, so look forward to reaching out and speaking to you along the way. But I think at this point I'll turn it back to Sabrina, who's got some information to share with you about data and how that's an important part of the project as well.
Thank you, Lindsay. Hi, everyone. Can you hear me okay?
We can.
Okay, great. So thank you so much. Here you see there's a screenshot of the portal, and I know most of you would be able to have been in the portal and have kind of used it to apply for your registration and application. So kind of the next steps there on that is that you're going to be using the portal again for your monthly submission of data. Sorry, not monthly, quarterly. And so the first submission is due end of January, and that's for data from November 2019 to end of January 2020. And so what that looks like when you go into there is, as you see on this orange kind of circle, that's going to be showing up as a task that you need to complete. So you'll just open it up, and it's a very simple form that you fill in around outcome and patient reach data, and again, you just save it at the bottom, and then on the left, just under this kind of green star, you see a button that says review and submit. So please make sure that once you input your data, it's not enough on the portal to just save it, but you do actually have to submit it in order for it to go into the portal and for us to be able to see it as a submitted kind of submitted report. And so currently, what you are going to be seeing as the next challenge is going to be the mini challenge number 1. That's going to be your next task because that is due January 17th, so that's due before the quarterly data report that's due on January 31st. So how the portal is set up is that things are in succession and in stages so that it's not confusing. There's one thing due at a time. And as Lindsay went over the mini challenge number 1, all that information is available in the terms and conditions. So please have a look through it. You can absolutely get started on it as soon as possible. The format is all there, and then just submit it before the deadline. And Amy asked a really good question. When will the winners of the kickoff challenge be notified? And that will be in early January as well. So as you can see in this kind of green star, this sample person has been awarded for one of the challenges. And so that's how you'll see it on the portal, and you'll also be getting an email from us. So lots of communication with us. And if you have any questions at all, Lindsay and I are more than happy to help you. So give us a call, give us an email, and I know a lot of you have been doing that, and that's really great. We're really here to help you succeed. And so if we move on to the next slide, we want to hear from you around what you'd like to hear from us in terms of developing the curriculum. And so these are some ideas that we heard from you in kind of the beginning survey. We want to hear from you to help develop the next 4 webinars that we have in the Momentum Challenge. We really want it to reflect what you need. So here are some ideas. Please vote for the top 3 if you can. Would you like to hear about prescription cascades, tools or resources for training volunteers, spiritual care, grief support for families or residents, how to sustain change? I know that's a big question. Principles of change management, resident or family partnerships, case studies around sustaining change, QI initiatives improving quality of life in long-term care, data visualization, person-centered care, resources and tools around those, or behavioral tracking resources and tools, and anything else. So if there's anything that you see that you'd really love to learn about but you don't see it on here, please send us a message in the chat box. And so we're getting lots of ideas, and this is really going to help us make sure the next webinars really inform things that you'd like to learn about. We're just going to give it another 10 seconds maybe, let everybody vote in, put in your final votes. We have some ties going on, so that's going to be fun. Okay, I think we're good. So thank you so much. We're going to be using this to inform our next webinars. And if you have any ideas that come up in between now and the next webinar, send us an email. Lindsay and I are always on that email address, the challenges email.
And we really, again, we're here to help you. So please let us know in any way you can.
Great, thanks, Sabrina. And just from what I saw, there was 50% of people had said they were interested in behavioral tracking. There was then particular interest, about 45% in each of how to sustain change, and also, sorry, I'm looking at my photograph version here, QI initiatives improving quality of life and long-term care. I think the only ones that didn't get a vote, interestingly, well, others, so that's fair. You guys can certainly share your ideas in the chat box. And tools, resources for training volunteers. But we'll go through this in greater detail, and as Sabrina and Lindsay said, we'll always be available to you if you want to follow up. We do like to develop the curriculum iteratively, recognizing that, you know, right now you're a good judge of where you're currently at in your improvement journey, and you know, a couple months from now, there may be things that you didn't foresee that you'll want to chat about or you'll want to listen to with new ears. So we're always happy to kind of continue to ask this question around what would you like to hear about next. We do also want to make sure, we didn't do it on today's call, but something that has worked particularly well in our previous Momentum Challenge and other collaborative webinars, this is a really important forum for you to hear from one another. So as much as we're going to provide resources to literature and tools and so forth, that's predominantly to facilitate conversation, because when it comes to, say, a leadership challenge, you know, many of you are working in the same setting, for example, you can provide expertise to the other. So it's nice to be able to start with this first challenge of the long-term success tool, because you're able to share with us where are you doing particularly well, where are your current weak spots, and we can actually do a bit of a pairing exercise. So if you have a weak spot and another team has some ideas to share, we can kind of leverage that opportunity for you to do that via the webinar. I want to mention a couple things that just came through in the chat. Cheryl, we had sent you a note, so from Lifestyle Options, you had shared that you use a similar tool. We were just curious to know what tool that was, so maybe on a future webinar you could share that with us. Also just curious to know if, like the long-term success tool, it's a tool that you use iteratively throughout the course of a project to check in on sort of status insofar as sustainability and success. We'd love to hear about that. This is, you know, one particular tool that we're endorsing and sharing, but there are many tools. As if you go back to those particular papers by Dr. Lennox, you'll be able to see reference to a number of sustainability tools. And it's important that you choose the one that's right for you. We're going to use that as a basis, of course, for the upcoming award, but ultimately we want to help make doing the right thing the easy thing to do, and so these tools help to facilitate that quality improvement in practice. You know, is what you're doing delivering what you thought it would? If not, why not? These are all kind of variations on that particular question. There was a question in here about when the winners of the first challenge will be announced, and Sabrina answered that. She had shared that that would be, I believe, Sabrina, you've written here somewhere in January. Let me confirm that. So we'll send out the terms and conditions and details again after this webinar. And yes, so the awards will be announced in mid-January before the mini challenge #1 deadline. But you will be receiving post-webinar a full list of upcoming dates, as I had mentioned earlier. We have an opportunity, we have a few minutes, if you did have any questions for my colleagues, Lindsay, Sabrina, Jason as well, who I think did a tremendous job. Like, can you just imagine what's going to happen when he presents his own slides? Because that was a pretty great interpretation of Laura's slides. I'm sure she'd be really pleased with that delivery. I did have one question, because Jason had alluded to a paper that he is coming out tomorrow related to leadership development. So Jason, do you mind giving us a heads up as to what that's about?
Yeah, it's quite happy with it, actually. As many of you, if any of you is a researcher, you know the process is long. But it's in a journal that's recognized highly in medicine and business, and the title is Evidence-Based Leadership Development for Physicians, but it applies equally to everyone in healthcare. And essentially, in my field, the range of credibility of evidence is total, from close to RCTs to basically the author's opinion about what was great, not reinforced at all by objective data or control group. So we basically created a tiered ranking system based on the credibility of the studies, frankly. So as technical as the language is, what I hear all the time is, we know leadership is important, we don't have a lot of money, and we need to know what is the most reliable evidence. So this tiered ranking system basically says, here's the gold standard evidence, and here's what they promote. And so the paper is a summary of the gold and silver studies. You can't, everyone, the worst you can do is bronze. You don't want to offend the other authors who might be your peer reviewers, but it's quite clear what is the most reliable evidence, and then out of that in the same paper is a model of leadership development, very similar in many ways to Dr. Lennox's model. And that's the one that's coming out tomorrow. And then the next one to be submitted is on the application of learning, or what's sometimes called training transfer. What do we do before, during, and after leadership development to optimize the impact? Because just as I mentioned during the presentation, just having a rockstar program is not enough if we haven't prepared the organization and our colleagues and our CEOs for what's coming. So I think they're equally important and very, very similar to the work that Dr. Lennox is doing.
Fabulous. Okay, great. So we'll see if we can integrate that into a future webinar, but we'll certainly also share, Lindsay had shared that we're developing a resource hub where we can share these sorts of resources. So we had just shared a link, for example, to an Institute for Healthcare Improvement resource. You saw the papers referenced today by Dr. Laura Lennox, the long-term sustainability or success tool rather, in greater detail. So this can be a place where rather than having to each file it, you can come back and access it. And thanks, Cheryl shared back from Lifestyle Options, the tool that they're using, and I just got a quick view of that online. It's a goal-oriented change management model that guides individual and organizational change, and it focuses on 5 tangible and concrete outcomes that people need to achieve for lasting change: awareness, desire, knowledge, ability, and reinforcement. That's the acronym that Cheryl's used there. So thanks for sharing that. Not seeing any other questions. I think I'm going to move to close the call, but if you have any late breakers, feel free to share them. Our next webinar is actually February 25th, 2020, so we'll see you in the next decade at noon Eastern Time. I want to thank everybody for joining us today. Jason in studio, Laura for preparing these slides, Lindsay, Sabrina, Emily who's been translating behind the scenes, Mihaela and Kelly who make this webinar possible, they're producing, and then all of you, of course, thank you for taking up this opportunity to continue to work with the Canadian Foundation for Healthcare Improvement to sustain the improvements that you have started. We know this is tough work, and the hard work often happens when we're not there, so we hope these webinars give you an opportunity to boost your spirits, give you a little bit more to keep going in the work that you're doing every day. Take some time now to fill out our closing poll. We'd like to know what worked well, even better if. So take a couple minutes to do that just before you head out, and we'll look forward to connecting with you all in the new year.
Thank you very much, everyone, from all of us.
Yeah. We're going to keep the poll open just for a moment, and then I'll come back to close the call. Thanks. Okay, thanks everybody. I'll formally close the call, and happy holidays. Thanks for those messages as well. Have some time to rest and relax, rejuvenate, all that good stuff over the holidays, and look forward to chatting with you again in the new year.
This concludes today's webinar. Thank you for your participation. You may now disconnect.